Delegates in Washington for the summit from countries hit hard by the Ebola virus faced additional screening upon their arrival. West African nations are dealing with the worst ever Ebola outbreak. The death toll has risen to more than 880. The spread of the disease has far outpaced the efforts to contain the virus, with dozens of deaths weekly. To discuss the growing problem, I'm joined by Priscilla Wald. She's a professor of English at Duke University and author of Contagious: Cultures, Carriers, and the Outbreak Narrative. Thanks so much for joining us. Let's start with some of this promising news. What do you make of this Sub-Zero serum, which was flown to Liberia to help these American patients who are now being treated in Atlanta? And what might this mean for the larger population infected in West Africa, do you think?
I think it's really very positive news, and I'm heartened to hear that there's some kind of treatment. Obviously, for something that is actually as rare as Ebola, the financial incentives aren't always there to develop put the kind of research in to develop this kind of treatment. So it's wonderful that they've had the resources they've had to develop this. It's very good news for the American patients, and it's very good news for everybody. My concern always with the difference between how an epidemic is going to manifest in the United States and how it might appear in Africa has a lot to do with access to health care. And as many people in the United States as don't have access to health care, even more people don't in Africa. And that's really the cause of not the cause of the outbreak or even of its spreading, but it would certainly alleviate, help to alleviate the spread of this disease if there were more access to health care in Africa.
Right, it's a case of the have and have-nots, I guess you'd say. In Contagious: Cultures, Carriers, and the Outbreak Narrative, you talk about the movie Outbreak, which was fictional, but the film began with a real quote from Nobel laureate Joshua Lederberg, which you mention in your book. Viruses are the single biggest threat to man's continued dominance on the planet, which sounds pretty ominous. We've seen the outbreak spread in West Africa. We're seeing the screening of delegates to the U.S.-Africa Summit here in Washington. Of course, there are the patients coming with the disease to Atlanta. So there are these fears of the spread of this outbreak to the West. Now, are they real or imagined, would you say?
I think to some extent they're real. I think I wouldn't worry at all about the spread from the two doctors because the way that they're being transported by professionals in special equipment and so on really makes that extremely safe. I would be more concerned about the people who are coming back, who are being screened, and that some of the aid workers have been brought back and volunteers and so on. And obviously they're being carefully screened. I don't think it's a huge problem, but whenever you're traveling on an airliner doing that kind of contact with crowds of people, there's always going to be some danger. But again, I don't think that's really the biggest problem we should be worrying about. And in response to Joshua Lederberg's quotation, the virus is a threat, but it's what allows the virus to amplify, which has a lot to do with how we're thinking about the environment, what measures we're taking to solve our environmental problems, our economic problems. The biggest single vector that turns an outbreak into an epidemic and an epidemic into a pandemic is poverty. And I would like to see us talking more. Here we have the opportunity at the African Summit. How much is global poverty on that agenda? How much is universal access to health care, such as has been called for by the Declaration of Alma-Ata in 1978. Margaret Chan reminded us of that in 2008 in her World Health Organization annual speech. Why are we not continuing to work harder towards universal access to health care? And why are health care and poverty not higher on the summit agenda?
Well, you bring up some really good points. Unfortunately, we've run out of time. Priscilla, thanks so much for joining us from Seattle, Washington.